Welcome to Dr. CM Edcast, your go-to resource for medical learning. Through discussions, case studies, tutorials, and debates, we help you learn, grow, serve.
All right, here's our game plan. We're going to tackle this in 6 parts. We'll start with the blueprint, then watch the major arteries and veins get built. After that, we'll check out the super clever fetal life support system, witness the huge switch that happens at birth, and finally, look at what happens when this precise process goes wrong.
So our story begins right where all life does, with the fundamental building blocks. Every single complex structure in our body, including this massive vascular system, starts with a simple plan rooted in our primary germ layers.
You know, the body uses 2 really brilliant strategies to build this network. First up is vascular genesis. This is like building the main interstate highways from absolute scratch using brand new precursor cells. Then you have angiogenesis. This is more like building all the local roads and side streets that sprout off the main highways, expanding the network into every single neighborhood, every tissue.
So how does this whole vasculogenesis thing actually work? Well, it's this beautiful step-by-step process. It all kicks off in the mesoderm, that's the middle germ layer, where some cells get the signal to become these things called angioblasts. These angioblasts then start clumping together, forming what are called blood islands. And then, like magic, these islands all start to merge, forming the very first primitive network of vessels.
And what's conducting this whole symphony? It is definitely not random. It's all guided by molecular signals, with one master conductor called VEGF. You can think of VEGF as the foreman on this massive construction site, shouting the go signals, telling cells where to grow, when to connect, and how to form a working network. Seriously, without VEGF, the whole project would just be chaos.
Okay, now let's see how that blueprint is used to build our major arteries. Really early in development, we form this series of temporary structures called the pharyngeal arches. Just think of them as a kind of biological scaffolding. They're only there for a little while, but they are absolutely essential for laying down the foundation of the great arteries in our head, neck, and chest.
This table just shows it perfectly, how our final anatomy is completely dictated by this temporary blueprint. The third arch? That becomes our carotid arteries, which supply all the blood to our brain. Now the fourth arch, it has a split personality. On the left side, it becomes the main arch of the aorta, but on the right, it forms the right subclavian artery. And the sixth arch is critical for our lungs, forming the pulmonary artery and a vital fetal structure we're going to talk about in a minute, the ductus arteriosus.
Now, while all the arteries are taking shape, an equally intricate story is happening on the venous side. This is no simple task. It's a really complex dance of vessels forming, fusing together, and even some being programmed to disappear, all to create the veins that bring blood back to the heart.
So at first, the embryo has 3 main sets of paired veins. The vitellion veins, which drain the yolk sac, get completely remodeled into the liver's portal system. Then you have the umbilical veins bringing in that precious oxygenated blood from the placenta, and here, something interesting happens. The left one sticks around, but the right one completely degenerates. And finally, the cardinal veins, which drain the embryo's body, go through this massive reorganization to form our superior and inferior vena cava.
And that brings us to the fetal circulation itself. See, before we're born, our lungs aren't used for breathing air, right? So the whole system needs a series of brilliant bypasses, or shunts, to get oxygen and nutrients from the placenta directly to the developing body and brain. The first of these shunts is the ductus venosus. All this oxygen-rich blood comes in from the placenta through the umbilical vein. This shunt acts like an express lane, letting a huge chunk of that blood completely bypass the fetal liver and flow right into the inferior vena cava, making a beeline for the heart. This is a critical trick to make sure the most oxygenated blood gets to the most vital organs first.
Okay, so once that good oxygen-rich blood gets into the right atrium, we hit the second shunt, the foramen ovale. This is basically a little doorway between the right and left atria. Since the lungs are just filled with fluid and not doing anything, it makes no sense to send all the blood that way. So this shunt lets the best blood flow directly from the right atrium over to the left atrium, ready to be pumped by the left ventricle up to the brain and the rest of the body. Pretty smart, right? And the third and final shunt is the ductus arteriosus. Now, any blood that does get pumped from the right ventricle into the pulmonary artery is mostly deoxygenated blood coming back from the fetal body. To avoid flooding the high-resistance, fluid-filled lungs, this shunt connects the pulmonary artery directly to the aorta. It diverts that deoxygenated blood away from the lungs and sends it into the main circulation to head back to the placenta to get more oxygen. But here's the thing. All of this incredible, intricate plumbing is temporary. The moment a baby is born, with that very first breath, the entire system goes through one of the most rapid and dramatic changes in the entire human lifespan. The whole life support system has to switch over in an instant.
And this right here shows the change perfectly. Before birth, the resistance in the lungs is super high, so the pressure on the right side of the heart is higher, and that's what keeps those shunts open. But that first breath inflates the lungs, causing a massive drop in that resistance. All of a sudden, the pressure on the left side of the heart is higher than the right. This pressure reversal literally slams the door shut on the foramen ovale. And at the same time, hormonal changes trigger the closure of the ductus arteriosus and ductus venosus. Just like that, the shunts are closed, and the adult circuit is born.
Now, understanding this super precise sequence is so critical because if any single step fails, the consequences can be life-altering. This is exactly where the world of embryology connects directly with the day-to-day realities of clinical medicine.
So let's think about that for a second. We've just seen how absolutely essential it is for these shunts to close at exactly the right time. So what would happen if one of them just stayed open? Well, a classic example is something called a patent ductus arteriosus, or PDA. The developmental error itself is simple. The ductus arteriosus doesn't close up, but the consequences are all about the new pressure dynamics. Now, the high-pressure oxygenated blood in the aorta flows backward into the now lower-pressure pulmonary artery. This left-to-right shunting overloads the lungs with way too much blood flow, which can lead to dangerous pulmonary hypertension and a lot of strain on the heart. So, as we wrap this up, I want to leave you with a thought. We've just walked through this incredible process of precision engineering, from tiny molecular signals to massive structural shifts. Considering everything we've talked about, which single event do you think is the absolute linchpin for survival at the moment of birth? It's really a testament to the remarkable engineering that gets every single one of us here.